Have you ever walked into your elderly parents' room and found them looking confused, unable to speak clearly, or even failing to recognize you? It's one of the most terrifying moments any family can experience. You might immediately think of a stroke or dementia, but in many cases, this sudden decline isn't permanent. It's a sign of severe dehydration. Today, we're going to answer a question that worries countless caregivers. How long does it take for an elderly person to fully recover from severe dehydration, especially when they're experiencing slurred speech and confusion? In this video, I'll explain exactly what happens in the body, how long each stage of recovery typically takes, what you should expect, and most importantly, what you can do to help your loved one heal safely and comfortably. Let's get started. First, let's talk about why dehydration hits seniors harder than younger people. As we age, our bodies naturally lose water. Older adults have about 10 to 15% less total body water than younger adults. That means there's a much smaller reserve to draw from. On top of that, the sense of thirst becomes weaker, so they might not feel thirsty even when their body desperately needs fluids. Certain medications, like diuretics for high blood pressure or pills for heart failure, make fluid loss even worse. If your loved one also has diabetes, kidney disease, or dementia, the risk skyrockets. This combination means a senior can go from mild dehydration to severe dehydration shockingly fast, sometimes in less than 24 hours. And when dehydration progresses to this point, the brain is one of the first organs to be affected. That's why confusion and slurred speech are so common. Before we look at the timeline of recovery, it's important to recognize the different stages of dehydration. Mild dehydration might show up as dry mouth, fatigue, slight dizziness, dark yellow urine. Moderate dehydration can include rapid heart rate, low blood pressure, headache, reduced urination. Severe dehydration, the most dangerous stage, often looks like this: very low or no urination, sunken eyes, rapid breathing, skin that doesn't bounce back after being pinched, severe confusion or irritability, slurred or incoherent speech, unresponsiveness. If you notice slurred speech or sudden confusion, treat it as a medical emergency. You should call 911 or emergency services immediately. Prompt treatment can mean the difference between a full recovery and permanent damage. Now, let's answer the question you came here for. How long does it take for an elderly person to recover once severe dehydration has already caused slurred speech and confusion? The answer isn't the same for everyone. It depends on how quickly treatment begins, how severe the dehydration has become, underlying health conditions, whether there were any complications like kidney injury or infection. Here's a general recovery timeline. First, 24 hours. After receiving for fluids and electrolytes, many seniors begin to regain some clarity. You may see improvements in alertness, speech, and the ability to follow instructions. However, fatigue and weakness are still common. 24 to 72 hours. With continuous hydration and medical supervision, confusion often resolves significantly. Speech clarity usually improves within the first 2 to 3 days if no stroke or neurological damage occurred. Appetite and normal urination may return gradually. 4 to 7 days. Energy levels start to rise. Cognitive function continues to improve. Mobility becomes easier as muscles rehydrate. 7 to 14 days. In most cases, seniors are back to their baseline cognitive and physical function. However, if dehydration was severe enough to cause kidney stress or delirium, it can take weeks for full recovery. Longer-term effects. If dehydration lasted many hours or days before treatment, or if the person has dementia, some residual confusion or fatigue may linger for several weeks. Remember, every person is different. Some recover quickly while others need extra time and support. When your loved one arrives at the hospital, the team will check vital signs like heart rate, blood pressure, temperature, and oxygen levels. Perform blood tests to assess electrolyte balance and kidney function. Start 4 fluids to slowly rehydrate the body. Monitor for complications such as heart failure if fluids are given too quickly. Watch mental status to ensure the confusion improves. Important. Slurred speech can also indicate a stroke. That's why doctors always rule out other causes before assuming it's just dehydration. If no stroke or infection is found, rehydration and electrolyte correction are usually enough to reverse the confusion. After the hospital stay, your loved one will need extra care and supervision. Here are essential steps to help them recover fully. Hydration routine. Offer small sips of fluids every 30 to 60 minutes. Use electrolyte solutions if recommended. Keep water within easy reach at all times. Balanced nutrition. Include soups, smoothies, fruits, and vegetables high in water content. Avoid caffeine and alcohol, which can cause fluid loss. Rest and monitoring. Encourage plenty of rest in a cool, comfortable environment. Watch closely for any return of confusion, dizziness, or reduced urination. Keep a daily log of fluid intake and output if recommended by the doctor. Follow-up care. Schedule follow-up visits to monitor kidney function and electrolytes. Review medications to see if adjustments are needed to prevent future dehydration.